Hi everyone, my name is Bethany and I'm a fourth year nursing student at the University of Calgary.
Hi, everyone. My name is Faith, and I was so honored to be one of the COVID-19 Leadership Scholarship recipients.
My name is Nadia, and I received the COVID-19 Leadership Scholarship based on my Term 5 acute mental health placement at Rockview General Hospital.
I'm really thrilled to be receiving the COVID-19 Leadership Scholarship this year for my work in Term 6 and during the summer where I had an undergraduate nurse employee position in a rural setting. All of my clinical placements for my degree have taken place during COVID, and my work with the nurses on the front lines during this time prepared me for the acuity of my summer job last summer.
We worked with a group of Yazidi refugees living in the Bowness community, and they were tackling a lot of barriers due to COVID and being isolated, but also just having to deal with a lot of their previous trauma, not knowing English, trying to introduce themselves in a community where everybody was isolating because of the pandemic. So it was a real privilege to be able to work with these ladies. Their story reminded me a lot of my own family's history of migration coming to Canada, so it made the project extra special to me and really inspired me to take more of a leadership role in getting our group together, getting us excited for this project, brainstorming when we had a lot of conflicts or had to problem solve. So eventually we were able to get the ladies to host their own booth at a local Christmas market, and it was a huge success. They told their story. They were able to even practice a lot of their English, learn, physically see their neighbors and who they were living around. So it was really special to be able to be part of that. They raised a lot of money, which was also really cool. So I learned a lot about community health, a lot about what nurses actually do outside the hospital, and I don't think there's ever been a placement that has really affected me the same way.
From this placement, I learned the importance of considering the patient's mental and physical presentation, as both have contributed to their hospitalization and both will ultimately contribute to their health journey post-discharge, no matter which unit they may be admitted to. From this placement, I also learned the importance of a therapeutic conversation as an important assessment tool for picking up implicit and explicit details and as an intervention based on their terms.
So I was able to work through another wave of the pandemic and care for patients experiencing COVID amidst their other health concerns. Being a learner throughout the pandemic has been really challenging at times, but the selflessness, compassion, and determination that I've seen in the nurses I've learned from have kept me inspired and grateful to be a part of this profession.
Thank you so much to my clinical group for being amazing during that term. Thank you, most of all, though, to my nursing instructor, Megan D'Souza, for really supporting my learning during that term, really helping me embrace those leadership qualities and making me the nurse and the student nurse that I am today. She also helped support my application to this award, so thank you so much.
Thanks so much.